Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stackelhouse, and this is episode 123. In today's episode, rheumatologist Dr. Isabelle Amigues will be sharing her journey from doctor to patient with stage 4 breast cancer back to doctor, and how her experience as a patient has changed how she approaches treating her patients today, including those with fibromyalgia. Dr. Amigues will also share the common rheumatological conditions that are missed in fibromyalgia, the signs that there might be more going on than just fibromyalgia, and why it's important to have the correct diagnosis. As always, I want to remind you that while Dr. Amigues is a rheumatologist, the information included in this podcast is not meant to be considered medical advice, nor is it intended to replace consulting with a qualified physician or other healthcare provider. Dr. Amigues and I really hope that you will take the things that you hear today and that you will share it with your own doctors and providers. Now, let me introduce you to our guest. Dr. Isabelle Amigues, as I mentioned, is a rheumatologist. She trained both in Paris and Columbia University in New York City. At age 40, Dr. Amigues was diagnosed with stage 4 metastatic breast cancer. A timely meeting with a non-traditionally trained practitioner taught her a different approach to disease. She experienced the power of meditation, visualization, energy healing, and, most importantly, love. Her journey through cancer inspired her to learn more about these alternative techniques, and now that she has studied many of them, she has integrated them into her own practice of medicine. She is the founder and CEO of Unabridged MD and sees patients in Denver, Colorado, and a few other states that she mentions in the interview. She is also the author of multiple book chapters and scientific articles. Her podcast, Unabridged MD, can be found anywhere you listen to podcasts. Make sure to keep listening after the interview. I've got some additional resources that we weren't able to mention during the episode, as well as this week's listener shout out. Hi, welcome to the podcast. I'm so excited to be talking with you.
Yeah, and thank you so much for having me. I really appreciate this.
Oh, thanks. So why don't we start with your story? Because unlike a lot of doctors that we talk to, you kind of have your own history and you understand maybe a little bit better than a lot of other doctors might. So why don't we start there?
Yeah, absolutely, with pleasure. I think I have to start from the start, which is number one, I cannot hide, I'm French. And I trained as a medical doctor in France. I did everything. So I did my medical studies, and then I did my residency, and then I did my fellowship in Paris and then in Lyon. And then I moved to the US in New York City for love, which is, the best reason. And also because I really like doing research in New York City. And I repeated my residency, repeated my fellowship, then when I Columbia University, and then we got twins, and it was very hard to have them, and they were very preemie when we got them. So I feel like my life already changed a little bit then. And when we basically decided at that point, hey, we have twins, we're in a 1-bedroom apartment.
And a New York size 1-bedroom apartment, right?
Oh, exactly. Yeah, that's true. And so we're like, yeah. And so we have twins. Let's get out. As cool as New York is, honestly, for kids, I didn't feel like it was the best anyway. And so we moved to Denver, and I took a position at National Jewish, which is a world-class institute, did some research and really loved it, actually. And then at 40 years old, after having done my 2 trainings, and how do I explain this? So basically up until late in my 30s, I was just in this fellowship residency. I was making good money, right? Like a resident and the fellows are making good money for a number of hours, maybe not, but for, you make still a living. And, but you're being asked to to just be the best of what you can be, right? And then suddenly you're thrown into, this is who you're going to be for the rest of your life, and attending. And I kind of like was like, wow, this is what I've been training. So 17 years of training, because I did research and so on, 17 years of training, but like, this is it, and I didn't really have very good connection with my kids. We can go into why that was, but one of the reasons was that they were so preemie. It had been very hard to get them. They were so preemie when they came out. They came out at 6 months. So they were a full trimester in the NICU.
Wow.
And so you don't know, right? Like, you're like hoping for the best, but you do not know if they're going to make it. And so, right, so it had been so hard to make them, and then so hard to, put them into the world. So I think I was a little bit like not completely sure that they were going to be there for good. And so I think that my attachment wasn't full, although it is full, your mom, it is full, but maybe I wasn't so attached to them as maybe some other mom. Anyway, I felt very guilty for that. And it was a lot of work, honestly. Also, that's the other thing, being like having twins, a lot of work. And neither their dad or me had our parents here, because we were both foreigners. We're like, he's from India, I'm from France. And so, I'm not yet 40, but almost 40. And I see my life and I'm just like, wow, I am so sad. And and it's like, you don't realize it until you realize that you're sad, like until you start crying and you're like, why am I crying? And that one I wasn't crying because I was tired this time, right? Like I can cry because I'm tired, or I can cry because I'm emotionally like, oh, this is a beautiful movie, or this is beautiful, or something. In this case, I was like just crying, feeling sorry for myself, and being like, what have I done? Like, is this really the life I want?
Right.
And the interesting thing is that I'm a rock climber. I mean, I don't know if I can call myself a rock climber, but I love it. So I'm going to call myself a rock climber because I love rock climbing. And I was trying to get back to rock climbing because I was like, oh, the kids are 3 years old, so now it's a little bit easier. We have an au pair. And I started just trying to rock climb, and I met some people, and I just was like, wow, why am I not traveling in France? I could. And so I started like seeing sort of like what life could possibly be. And then just, that's probably why I became so sad, is like just realizing what my life could have been or could be, and realizing what my life was. And basically at this realization of how sad I was, and this realization that, we tried everything with my ex-husband to make it work, but just it was too much. And there was a lot of love, but I don't think we were in love. And so I think we were like, okay, what do we do? We're trying. And basically at that moment, basically 2 weeks after my 40th birthday, I saw this gigantic mass on my breast. And as a physician, the first thought was, of course, it's breast cancer, but I also have all the differential diagnoses.
Right,
and
exactly.
And so I was like, this is too big. This is too big to be a cancer. Like, right? Like, it's so big that you cannot fathom the reality of it. So I showed it to my husband, and he was like, yeah, And then I made an appointment. And the funny part is that I had kind of offered myself a trip to France for my 40th birthday. And I was like, my husband has an au pair, so he's fine. And then I'm going to go to France for 4 days. I'm going to be okay. Like, the kids are going to be okay. They have an au pair. My husband is going to be okay. I'm going to be okay. I'm going to go to France. And then I find this tumor, right? And so I get the biopsy, I get the mammogram, and nothing looks good, honestly. Like, and at that point, I remember, I think they were like, well, maybe you don't want to go to France. I was like, hell no, I really want to go to France right now. This is when I want to go to France. So I went to France, and I didn't have the full diagnosis then, because I basically did the biopsy and I went to France the night of, because that's how it had been planned. But, everyone knew what was going on, and I got the diagnosis the next day. So basically, I think I got the diagnosis after I had already taken, like, basically the night of the landing of my, in France. And I was, of course, jet lagged. But the really cool thing is that I got a phone call. Like, so basically my husband, I had told them to tell my husband what it was. And he was like, well, no, please have fun. You can have fun. You're okay. And I'm like, no, I mean, like, there's no way I
I
can
want to
have fun. Like, you
know,
gotta,
right?
but like, imagine, right? Like, my husband and I are not doing well. There's this tumor. I mean, like, how awful it was for him as well, right? Like, I mean, and then he has, gosh, I mean, like, I'm feeling like almost like overwhelmed with how much support he gave me, because it's so awful even for him, and he's a physician, right? So I was like, no, just tell me. And so he's basically telling me like it's undifferentiated. It's already attacked the lymph nodes. Attacked, I don't like that term, but it's already, it's already in the lymph nodes, which I kind of have an idea. So it was at least stage 3. And then he's like, it's highly undifferentiated, which is not a good sign in medicine. It's PR. I think one of the two is negative, PR negative or ER negative. I can't remember, because I was like, I don't want to be a doctor for this. Like, I'm not going to be a doctor for me. And then he's, all of this, and I'm like
Yeah,
just,
each thing was like a
more
blow.
negative.
Yeah.
Yep. And then suddenly he's like, 100% of the cells are HER2 positive. And I have no clue at that point what that is. And I'm like, that's positive, right? Like, this is a good thing, right? This is
Positive means good, right?
Yeah, in this case, I was like, this is good, right? And then he was like, well, and so, he's such a nerd. Of course, he had read about it. So he was like, yeah, actually, this might be good. Yes, and I had this one thing to hold on to. So I was like, okay, I'm going to go. Don't worry. Like, we'd figure it out. And my friend called me then. And it's funny, my mom was on the side. My mom, my dad, my brother, his wife, their newborn were all in this next door. We were at my brother's. And, the funny part is that I was a little bit superstitious. I was like, this is the newborn. Maybe I'm going to die, right? Because this is cycle of life, right?
Right. One
And
comes in, another one goes out, right?
yeah. And so my friend calls me at that point, and she's like, hi, Isabelle. Of course you couldn't do a normal midlife crisis. Of course you had to do at least stage 3 breast cancer. Like, of course, this is you. You're going to show us as it's done. And she's laughing. And she's not a doctor. I'm surrounded by a lot of doctors, but in this case, she's not a doctor. And somehow I'm going to believe her. She's right. I'm going to be okay. And another friend calls and she's like, don't you worry. And then she's like, and I was like, Marie, can you hook me up with your naturopath? And I had never seen a naturopath, but I was like, something is off. I was so sad. I was so depressed. There has to be a reason why I have got this cancer, right? Like there's something that I need to dig very deep. And so I met this naturopath on a Saturday morning. She opened the practice just for me, because I was literally in Lyon. So I was in Paris then, and I was going to Lyon to meet some other friends for like 1 day or 2, right? And everyone is like, wow, like I've got like this breast cancer diagnosis. I don't know what I'm doing, but I'm like, hey, we're gonna party, because this is like, we're not gonna let this,
Right, exactly.
And they are taking pictures, and I'm like, hey guys, I'm not dead yet. Like, that's not like, okay, come on, like, we're good. And it was so funny. Like she like my friend like told me about this recently. She's like, yeah, I was doing all those like Polaroid, like instant pictures. And I was like, this is a little weird, I'm not dead yet. Like, come on. And so she's like, yeah, you're right. And it was really funny. And it was like just this reframe of things, and yeah, I think that just this realization of I'm not dead yet, like, it's okay. I'm going to be okay. And I don't know, and I'm going to learn something from this. And this naturopath that I meet that basically tells me, don't see this cancer as as an enemy. See it as a friend that's here to teach you something. And the moment you've learned it, will go like any other good friend. And I was like, wow, I want to believe that. And I'm going to believe that. And it's kind of been this whole sort of journey of, look, at the end of the day, we only have one life. At the end of the day, I may die. The truth is that I may die tomorrow, maybe a car accident or maybe a bear. Like, I had not a friend, but I had someone that I knew from high school that I had kind of like reconnected on social media that died of a grizzly bear attack during that summer. And I'm like, I
Wow.
mean, I cannot decide when I'm gonna die. I just don't know. And so I have to live my life meaning well, with meanings. And I have to be okay to just be resilient in front of whatever it is that I am in front of. And just I am lucky that I get to live my life with intention because I've got this gift of this cancer that taught me, well, here it is. I have to deal with this and I'm going to deal with it. But I don't have to consider that this is the end of my life just yet. And even if I don't know when my life is ending, but I'm going to live my life intentionally. And that's sort of like this sort of journey to go into the deep meaning of who am I? What do I want? And so it's funny, right? Like someone could be like, you're going on this journey when like, wait, you don't even know if you're going to make it. And I'm like, exactly.
Mm-hmm.
I don't know if I'm going to make it, but at the end of the day, like I want to be true to myself, and be it 1 month, 2 months, 6 months, 6 years, 60 years, I want to be true to like, who am I really? Like, what am I here for? What am I doing? What do I want in this life? And can I reconnect with my husband? Can I reconnect with my kids? Can I connect with my kids? And all of those things. And I don't have an answer for all of it, but I had a lot more understanding of who am I. And someone was asking me this recently, and they were like, what was the biggest gift of your cancer? And I love me. Like
Mm-hmm.
I learned how to love myself, and it took more than just the cancer. It took a lot of work, but I think that that's the biggest gift that I've got, this realization of how much I love me. That
Mm-hmm.
sounds weird to say. Hopefully it doesn't get out of context. But
Right, right.
it's not a love it's not an egoistic love. It's really this love of, just understanding. And I think loving like this part of myself and me, it's really here. It's not the outside. Loving this has allowed me to love a lot more the people around me,
Mm-hmm.
be it my patients, be it my family, be it my kids, be it my friends, be it complete strangers. And just like going back to who am I, and going back to this human experience of death, which we all share, has allowed me to love me and to love a lot more everyone around me. So that has been the biggest gift. I think it's a beautiful one.
That's amazing. That's amazing. And breast cancer diagnosis, especially one as serious as yours, and a fibromyalgia diagnosis are not the same. So just to be clear there, but I
Yeah.
think there is like this sense of death of who you thought you were or who
Yeah.
you think you are, right? And you have to be a new you,
That's a
right?
beautiful way to say it. I think that that's exactly it. Who are you? And we are not just one thing for sure, but
Mm-hmm.
what is this bringing you, right? Like, 'cause you can see it in two ways. So first of all, yes, fibromyalgia is not the same, for sure. Like it's not a life-threatening condition,
Right.
but it is a pain in my butt condition, right?
Yeah.
I'm saying it
A pain
because
in
that
my
is,
everything condition.
yeah, exactly. That's true. That is absolutely true. And and I think that the acceptance is so key. And honestly, like as a rheumatologist, I can say it like it's not. I say it into all of my patients. Like you cannot, like you can only really truly heal once you have accepted what's going on. And so to me, it was accepting the possible fate of death, right? To me, like, and that's not, I think for some of my patients is to accept, hey, what is this fibromyalgia teaching me? Like, what can I learn from this? Because then you're reframing it into, oh, this is happening to me. This is so unfair. Why? Why can't it be leaving me alone, right? To hold on. Can I learn something from this? Right? Like, is there anything that is good in this? Did my relationship improve? Do I listen to my body more? And do I actually consider my body as a lot more than I used to?
Mm-hmm.
Do I take time? Do I allow myself to stop? And all of those things, right? Like, I'm just realizing, like, and I do this with my patients, and I love doing this. And I love when they do it. And when they are like, oh, I had not realized, but this had brought me this. Like, oh, thanks to this, I've done this. And it's not all negative. It's never, ever all negative. And I
No.
think,
Yeah.
I don't know if it's the new you or just the butterfly. And I love the idea of a butterfly, because I think there's this idea of, like, you're centered and you work. And I don't know if your auditors know, or even if you know, but if you cut the cocoon to help the butterfly get out, it dies. And so
Right, because it's the
there's,
struggle that strengthens the wings.
yeah,
Yeah.
exactly. And so it needs the struggle, and like to just like get out. And that's, maybe what fibromyalgia, maybe cancer, maybe another condition does to us, which is like, it's this difficulties, those challenges that shape us and allow us to be our new you, our better us, our improved us, our, 201, 202, I
Yeah.
don't know, 102 or.
Yes, yes. I love that so much, and I agree with that so much. I mean, fibromyalgia has been the biggest gift that has given me, truly. But not everybody can, like, that's a hard place to get to, right? To see it as a gift, or even see it as a friend. But I like the thought of it as a teacher, because you might not always like your teachers, but that doesn't
Mhm.
mean they aren't teaching you good things, right?
I love this. I think that's exactly, it's a teacher. Yeah.
Yeah.
Yeah. So, like, I think about this, and I'm like, I think that the cancer taught me how to love myself, right? Because then you're like, oh, I have this choice. I can leave, or I can leave.
Right.
And that was a choice. It allowed me that choice, and it was a teacher. And I think all experiences are teaching experiences. And the really cool thing about seeing it as a teacher for fibromyalgia, or any other condition really, is that it's not happening to you. You working with it, right? And sometimes as a teacher, it's like, like, I can't. Why so much? you know. But some other times you look back and you're like, wow, look at what I just did.
Mm-hmm. Yeah, exactly. So, how did that whole experience change your approach to medicine? Because you were a doctor before, you're a doctor after, but I
Mm-hmm.
imagine going through that whole experience changed things for you.
Yeah. So in so many ways, it changed so many things. I think, trying to put it into words, the number one is the appreciation towards my patients. And I'm going to explain this. So I had the opportunity to decrease my work quite a bit. In fact, some people were like, do you need to quit completely? And I was like, no, I'm not dead yet. So I'm not going to quit. And I'm like, I'm full of energy. I'm fine. But I do want to have more fun in my life, and I want to have the time to heal. So I'm going to decrease a lot my time at work. So I did this. And I continued to work with patients where I stopped completely any sort of research. Like, I couldn't do any research, whereas I loved seeing my patients and being in the stories of my patients for 1 hour, 2 hours, 3 hours per day allowed me to not be like looking at my own, potential misery, which it wasn't misery, but like, to be in the life of my patients. So a huge appreciation for them, and a huge appreciation for the trust that they are giving me, that they give me. I never lied about what was going on, and I never omitted it, because I used it to heal them.
Mm-hmm.
And so I would tell them what I was doing, what I was reading, what had worked for me, and then, share it. And so that was very healing from both sides. So that's a huge appreciation for my patients, so a huge amount of love really for my patients. The second is that you realize that there's not much empowerment that happens in medicine. I mean, and I loved my oncologist. I had to change because of insurance purposes. I hate insurance, but just like, yes, I loved my oncologist, but I was seeing her every several months, a couple of months, probably
Right.
more than the vast majority of patients would see their doctor. Right? And this realization that, wow, like, yeah, I mean, there's not much, like, yeah, there's a plan, medicine, great. But like in the meantime, what do? I cross my finger and hope that everything goes well, like what can I do to help? And so I actually read a book that I love called The Miracle Morning that goes over like all those things that you can do in the morning: meditation, visualization, affirmation, reading, writing, exercising. And I started doing all of them every morning. And that empowered me. And at the time, I was like, I don't want to read the science behind this, like, because I want to believe in the power of placebo. If this is placebo, 30%, I'm great. I want to do it. But it turns out once I was healed and everything good, I actually looked at the science and I was like, wow, there's science behind visualization. Wow, there's science behind meditation, exercise, all of it. I was like, I was doing it all because I was like, I want something to do that allows me to be empowered and it's on my own, right? While I'm waiting for I wasn't waiting, actually, that's why I wasn't waiting for the oncologist, but that's something that I was doing. So the empowerment of our patients, I think, is much more than it used to be. Like I make sure to have specific steps that I give my patients that are rooted in science, but really so that they know what they can do. And it's not just, oh, I'm going to wait for my medicine to work. Mm-hmm. So that's a huge one, right? Like it's empowering them to realize like, hey, if you do this diet, it's going to help you. If you do this exercise, it's going to help you, all of those. And I highly, highly recommend that for patients with fibromyalgia, because yes, there are a couple of things that work in like medicine wise, but it's so much a lifestyle changes that can do things. Yes. And we know it. Mm-hmm. So yeah, there's that. And the third one is the third thing that really it changed is the realization that the system was so broken that I couldn't be part of it anymore. And so I removed myself from the insurance system, and now I have created a practice that's very holistic, because I really wanted to see the whole patient and not just a part of them, so that I could really heal everything, like go all the way to the root of the problem. And I really, really love my practice, and I think my patients love it as well. And that has been life-changing to me, because it's really something I love to do.
Mm-hmm. And the more you dig into stuff like that, everything's all connected, right? We can't talk about treating your fibromyalgia without also talking about your sleep and your adrenals and your thyroid and your hormones. Yep. And mm-hmm. Yeah.
Totally. Totally.
And you are still working as a rheumatologist, or are you doing more kind of like primary care?
No, rheumatologist. I'm still a rheumatologist. I did it in France, did it again in the US. That's how much I love it. I love rheumatology. It's like the best specialty on earth, in the universe, probably, If they were Martian, I would help them with their rheumatologic disorders. I really, really, really love this. It's just so good. And, fibromyalgia is a rheumatologic disorder. I mean, it's so important. I think we were talking about this, like, how a lot of patients have fibromyalgia, but it's actually small fibers neuropathy. And small fibers neuropathy are very hard to make a diagnosis, to diagnose, because it's not obvious. And a lot of patients are being, told, oh, it's fibromyalgia, good luck, if they even say that. And you're like, no, actually, it was small fibers neuropathy, and there was a reason for this. And, so in this practice that I have now, I take a lot more time to dig into this and to figure it out. And so then to offer, treatment plan, which, you offer as well. And you see that as well, right? So, yeah.
Mm-hmm. So what are some of the other conditions that you would commonly see when somebody comes in and they say, I think I have fibromyalgia, or I've been diagnosed with fibromyalgia, and then you dig in?
Yeah.
What are some of the things you find?
Yeah. The most common, honestly, is Sjogren. So Sjogren is basically a dry eyes, dry mouth. So it's an autoimmune disorder that affects the gland. So it affects the salivary gland, affects the lacrimal gland, so what makes tears and what makes saliva. That's like the main one, but it actually can affect the nerve. And so that's when you would have the small fibrous neuropathy or fibromyalgia. It can affect the lungs, can affect, so much stuff like the blood and so on. And it's really to figure out that, right? Because if you have inflammation, you're going to have fatigue, and then that's going to cause your fatigue. And then the small fibrous neuropathy is going to cause this fibromyalgia symptoms. You can also have fibromyalgia associated with rheumatoid arthritis. So rheumatoid arthritis is going to present more with joint pain. That's inflammatory. So it's worse in the morning, associated with morning stiffness, so more than 30 minutes of feeling stiff in your joint, and then some swelling of the joints. And then lupus can also cause small fibrous neuropathy or fibromyalgia. So those are like main ones. They are the most common, but any autoimmune disorder can cause fibromyalgia. It can be associated with small fibrous neuropathy and can be associated with symptoms of fibromyalgia. And so then the question is, yes, so what's going on? Then we treat. But I think the most important thing is to basically suddenly tell our patients, like, hey, it's not your fault. Like, you didn't cause this. It's okay. Like, and there is a scientific reason for your body to cause this, and it's okay. And we can take care of you, and we're going to take care of you, and we're going to do it together.
Right, right. And some of those conditions that you talked about there, they have different treatments, but also they have treatments, right? And so, particularly for you listening, if you've been diagnosed with fibromyalgia and your fibro treatments are working kinda or not working at all, that is a great indication there's something more going on.
And it's funny because we say the same thing about the other thing, which is, so I really like this. So if, for example, you have rheumatoid arthritis and you treat it, right? We have amazing treatments now. There's a reason I did rheumatology a second time. It's like we have really good treatments. And so you treat it, and then there's still pain. And that's sometimes when you're going to be like, aha, maybe there is fibromyalgia now, right? And so you have both pain. You have the pain from the inflammatory arthritis, and you have the pain from the fibromyalgia. And so it's really important for your doctor to make the difference, because that's not the same treatment. I can give you as much immunosuppression as I want. That is not going to help with your fibromyalgia. Right.
Yeah.
And I can give you as many treatment for your fibromyalgia as I want. That will not help your inflammatory arthritis. And so it's really this art of what is causing, what is helping what.
Right, exactly. And fibromyalgia, I always talk about it as being an amplifier. If you've got other pain going on, fibromyalgia will just like crank it up a notch, right? So that's another reason to really make sure that you've treated any other pains that can be treated, so that lowers that back down.
Yeah. Absolutely.
Yeah. So, what advice would you have for somebody who's maybe listening to this episode and thinking, maybe there's some other things going on? How would somebody go about getting the right diagnosis, finding the right doctor, all that kind of stuff?
Yeah, it's a very good question. Okay, so fibromyalgia, you're going to have pain. And so that's really the main issue. It's pain in the soft tissue, meaning someone holds you and, takes you, and then you're going to have pain. And it's not necessarily just that, but like it's mostly pain of the soft tissue. You shouldn't really have pain of the joint per se.
So it'd be more muscles, right?
Yeah, muscles, soft tissue,
Skin,
like even the skin.
Yeah.
I've got some patient where it's like it's just the skin, the deep skin. It's not even when you're touching them, it's just a light touch and they're in pain. So in general, like, right, if you just have that, maybe it is just fibromyalgia. I find very often that fibromyalgia is linked to something else. So the symptoms that I would recommend to look for, and not think that it's going to happen, but like, just, be like, right now, if you're listening, like, do I have this? Dry eyes, dry mouth, dry vagina, right? Because that's another one. Do you have shortness of breath, chest pain? Do you have joint pain? Do you feel stiff in the morning for more than 30 minutes? Do you have any swelling of your joints at any time? Do you have the sensation of a numbness anywhere in your body where you're like, I'm not feeling this very much, right? Do you have hair loss? Do you have any rashes? Those are like the main one. And anything else, like basically, do you have just pain and fatigue? Of course, because pain causes sleep, like not being able to sleep as well, not being able to sleep as well causes pain. And it's like a vicious circle, right? And sleep is so important for pain, to relieve the pain. And so I think unless you have just that, then I think you have to see someone. If you have any of the symptoms that I've mentioned, I think seeing a rheumatologist is making sense. If it's any other thing, like if it's any other thing, I think that just talking with your primary care physician will help.
Mm-hmm.
Yeah.
And what about because I hear this from clients all the time, that they'll go to their doctors with these concerns and, oh, no, that's just your fibromyalgia.
Yeah, so this is where it's so annoying.
Yeah, it is.
It is, because I think you have to go back to what's going on in the medical field right now. People are being overwhelmed with work. They have to see more and more and more and more patients. They have to fill more and more forms. They have to talk to insurance to approve more and more medications. I mean, the road, like being a doctor, is more and more difficult. And now we are putting nurse practitioner and PAs to compensate, but they are being just as overwhelmed with work as the doctors. So it's also tiring also for them. So I think maybe going to the doctor and just say, hey, I know my fibromyalgia is there. I get it. Okay. Is there any chance that I might have something else? And I would love if you could help me, reassure me, to make sure that it is just my fibromyalgia. And just really coming from like, look, I know I have fibromyalgia and I understand this, but is there any chance that I'm missing something?
Mm-hmm. Like something else in addition to fibromyalgia.
Exactly. Mm-hmm. And just saying, like, it would reassure me. It would take off something from me. Can you reassure me? Right? Mm-hmm. And how do we know this? Can you teach me? Can you educate me? Mm-hmm. You need to have a physician that has the time, but make a second appointment. Make an appointment one day and an appointment the next day. Mm-hmm. If needed be, doesn't care. Like, right? Like at the end of the day, what they don't want, they want to address all the problem. And so you can say, hey, I made an appointment with you today. Let's do what you want us to do. But I want to tell you in advance, I've already made an appointment in a month or in 2 weeks or in a week so that we can talk about this concern. That is very important to me. Because at the end of the day, the physician wants to be compensated for that time. Totally understandable. Yeah. But they also need to make sure that they take care of you. And if, we have to take care of your diabetes, your hypertension, hyperlipidemia, they have to do this first before they can manage something that they don't think for them is as important as what you may think. So make 2 appointments in 2 weeks. No one is ever going to say no to that.
Mm-hmm. I like that idea of, this appointment, we'll do whatever you want, but yeah. I made another one and that's when we're going to talk about what I want. Yep. Mm-hmm. That's good. That's good. And I think, part of the reason this is really important, I mean, yes, some of it is for the bringing the pain down because fibromyalgia is an amplifier, but also some of these other conditions, when not treated, has some pretty serious side effects.
Oh yeah.
Right? Like rheumatoid arthritis, damage to your joints.
Yeah. Sjogren.
All of that.
Yeah. I mean, really, that's what it is. It's like, you want to really make sure when you have that first diagnosis of fibromyalgia that someone has actually looked into, can this be rheumatologic? And which is why when in my practice, I've always seen patients with fibromyalgia just at one time, right? Because then there's no immunosuppression to be given. So there's no need for me after a first diagnosis. But I think that it's absolutely fair to our patients to have at least one evaluation by a rheumatologist. I think that that's fair and that's appropriate. And the number of times I've seen rheumatologic condition, like I cannot put it on my finger, like it's a lot. And in France, for example, we used to treat fibromyalgia patients because we wanted to also help the primary care physician. So we were treating them. It wasn't all of our patients, but we were treating them, you know. And it's not, I want to work with the physician. It's not like the primary care physician, but yeah, I think that that's important. So, yeah.
So it sounds like then that here in the US, fewer rheumatologists are actually treating fibromyalgia. Is that
absolutely?
Yeah. That's what I've noticed as well. Yeah.
So there's not enough rheumatologists out there to do everything.
No, there is not.
And and so that's the issue, is that then it's like, well, we cannot really deal. So they might not. So this is where that's actually one of the things that actually bothered me, is that I felt that we're failing the system by not offering at least a first assessment to fibromyalgia patients. I'm not saying if they have a diagnosis of fibromyalgia, that's great, but like, have they ever seen a rheumatologist? I didn't want to be a second, third, fourth opinion for fibromyalgia, but at least a first opinion for sure.
Right. And largely to check all those other things and either rule them in or rule them out, right?
That's exactly right. And if it's going to reassure our patients, like, how is that troublesome? It's just a one time, you know, it's okay.
Right.
Like it's giving them good. It's fine. We can also teach them, don't ever take narcotics. When the narcotic was an issue, I would tell my patient, don't ever take narcotics. That's a big problem. You know, make sure you do not. Once you start, you cannot stop. And that's not going to help. It's a Band-Aid. Start exercising. Think of me when you have pain and you exercise. You know, and I would look at them. I'm like, it's not dangerous. Think of me. You have pain, that's normal. It's okay. Think of me.
Yeah.
You know, and I would tell them. And I would even say, I remember I had this French patient. I was like, just, if you're running on the side and you pass by and you have pain, just come and say hi, you know. And he did. He came to say hi in the hospital. It was great. I loved it.
Yeah. And what you're talking about here is the fact that with fibromyalgia, we feel pain, but there's no actual damage, right?
Exactly.
There isn't damage being done. So if you move through the pain or whatever, you're not going to hurt yourself. Yeah.
Exactly. And I think that that's important, is to have this realization, hey, it's painful, it's annoying, I get you, and I'm sorry. And it's not dangerous the way that rheumatoid arthritis could be dangerous and lupus could be dangerous. And how about this? Like, start running. Or I don't like running personally. Start walking, start rock climbing. And when you have pain, think of me instead of thinking of the pain. You can curse on me. It's fine. Dr. Amigues, I'm doing this exercise. I have so much pain. That's okay. You know, you can curse at me. It's okay.
Yeah. You know. The other thing that I wanted to point out here for you listening, if you didn't quite catch this, if you do schedule an appointment with a rheumatologist, don't necessarily go in asking for help with your fibromyalgia. You want to go in to make sure there aren't any other things going on.
That's a really good point. Absolutely. And I think the really cool thing is that your rheumatologist will be so grateful to you if you do that. And you can always ask them towards the end, hey, do you have any recommendation for my fibromyalgia treatment, or something that you can tell my primary care physician? So personally, I have a huge paragraph going through every single plan that I recommend, that I share with all the primary care physician in the note. Yeah.
That's good. That's good. So as we wrap up then, I would love for you to just kind of share from your heart to theirs, both from your experience as a doctor, as a rheumatologist who sees patients like us, but also from your experience as a patient. Maybe there's a person out there who's like, I don't know about this teacher here to teach me things, or maybe there's somebody who's like, yeah, but I've gone to the rheumatologist and they weren't any help. I would love for you to just talk to those people right now.
Yeah, no, absolutely. Um, so the number one is the acceptance. So I give a TED talk on that actually, of not seeing our diseases as an enemy or in a fighting. So right, we say dis-ease as if they are separated, these, separated from us. I say condition. Con is with. We are working with our conditions. We are working with our bodies. I see my body and I see the body of my patients as little kids that are so cute. And I see them as they need help sometimes, and I'm here to help them. And sometimes they need teachers, and we have conditions that are here to teach us, right? And you're helping them. You're helping every single cells of your body to feel better, right? And so I think once you accept that, and you're in a place of acceptance, then you can really heal, because then you can always heal, but by accepting, you're not fighting. So you're not activating the stress and the cortisol level and so on. We can go into the scientific part of this. But by accepting that you're working with this condition, you're basically allowing your body to say, okay, it is what it is. Now let's heal. How do I heal you? What can I do for you, my body, right? Like, what do you need from me today? And I think going from there, instead of being like, oh, I am so upset, my fibromyalgia again is acting up, be like, hey, buddy, what do you need from me today? What can help you? Would a massage help you? Would meditation help you? Would talking with friends help you? Would talking with your mom, your dad, your kids? Would going outside help you? Would going and getting some sun? So this is really something I am very passionate about. It like at one point, if you're feeling like, what do you need today, my buddy? Like, buddy, what do you need today? What can I do for you today? As if it was a very good friend. And I think that that's something that anyone can do, because all of us have friends. And and it's funny, like my patients with fibromyalgia, when I ask them, are you a good friend? All of them tell me yes, all of them. And so I'm like, okay, so then you know what it is to be a good friend. So then you're going to be a good friend to your body. And that I think we can do. I didn't say to your disease, I didn't say to your condition, but you can be a good friend to your body. What does your body need right now? Does it need to feel crappy because you think that it's failing you? Probably not. The same way that when a kid doesn't know how to write or is not potty trained, we're not being upset about it. We're training them, teaching them, but we're not beating them up. At least that doesn't work. I can tell you that. We know that. And so I think that that's the first piece. The second, when it comes to doctors in general, I really am of the belief, the conviction, really, more than a belief, that we as patients are the quarterback, or I don't know, are the main, not the quarterback, but the most valuable player on the team. We have coaches along the way. We have team members along the way. But we're not going to stay with a coach that doesn't work for us. And so, you look at the coach and the relationship we have with your coach, in this case, a doctor, right? And if it doesn't work for you, you move on. And it's really not like there's no guilt to have. There is no feeling bad about it. It's okay. Like, it's just, you need the best coach for you, for your body. And I think that's the second piece of advice that I would give, is that how your doc makes you feel is so important. Do you get out of the visit with feeling hopeful, feeling energized? And if that's the case, then absolutely continue. That's the right person for you. Even if they have asked you to exercise and to work, and you're gonna do this, fine, and curse on them, But at the end of the day, if you feel energized and hopeful, that's the right doctor for you. If on the other side, you want to go back home and go under the cover and not move, that's probably not the right doctor for you. And we're human. Like, doctors are human. They have affinities exactly the same ways that us as patients have affinities. So it's the same thing. Maybe they didn't like you as much as like they could. And if that's the case, then work with the right person, because there are doctors out there that are going to love you.
Mm-hmm.
Yeah.
Yeah. I love that. I love that. There is nothing wrong with finding the right person for you. Like, not only is there nothing wrong with it, but it's essential.
It's essential. Yeah. You want a good coach.
Mm-hmm.
I really think that the doctors are the coach,
Mm-hmm.
right? They talk about what we're going to do on the field. They give a plan and we just try,
Mm-hmm.
and but then they also take care of their team. They know how to push and they know how to back off. And that's how I see my role as a doc. I'm here to help. I'm here to support. I'm here sometimes to push my patients,
Mm-hmm. That's right. That's right. Because that's what you do if you are truly loving and caring about somebody, right? That tough love. Kicking the butt, right?
Yeah, absolutely.
So if people want to connect with you, you've got a podcast, all kinds of things. So share with us how people can find you.
Yeah, absolutely. Thank you for that. So I'm Dr. Isabelle Amigues, Amigues, and my podcast is called Unabridged MD. And so it's actually also the name of my practice, and it's also all the social media under Unabridged MD. The reason why is that I love that word. The reason why I wrote this, like unabridged, is that it's a non-edited version of the patient and the physician. You get the whole of me and hopefully of other doctor when they come, and you get the whole, like we look at the whole person. So you don't have, when you were saying, hey, when you go to your doctor, don't ask them this, ask them that. Well, in my practice, my patients don't have to think like that because I'm interested in all of the aspects of their health. And so that, like, I don't want them to stop themselves from telling me what, what's next, what's in there for them and what's going on and so on. And so that's why I called it Unabridged MD for just medical doctor. That was important to me. So and I have the podcast and we talk about the mindset a lot. I bring on guests as well. But the mindset is such an important piece. The reframing, it's not happening to us, it's happening with us. And I think that that's really important. So the podcast, that's really what I talk about all of the time.
Mm-hmm. That's awesome. That's awesome. And do you only see patients in Denver? Do you see patients telemed other places?
I do telemed as well. So I see patients that I am licensed in Colorado, Michigan, Wisconsin, and Minnesota. And so I can see patients telehealth in all of those states. So I actually have patients that have kind of like, taken the car, like crossed the corner and said, okay, I'm in Michigan right now, or I'm in Wisconsin. They do that. I get this, I really do love what I do, and I try to get my patients to remission. So, they like it. They want that.
Exactly.
And so you can look at my website also. But the podcast, the website, I have a rheumatology video if you're interested, like a YouTube video, Rheumatology 101. It's more granular. It's more rheumatology because I love teaching rheumatology. But Unabridged MD, and it's the website is the same, unabridgedmd.com. Everything is Unabridged MD.
Perfect. And we will have all of that on today's show notes page. It'll be at fibromyalgiapodcast.com/123, episode 123. Thank you so much for being here, for sharing your story. And I just love your approach to all of this. I wish we had a lot more doctors like you.
Thank you. And thanks for doing this. I think this is so valuable to everyone. Fibromyalgia is such an undertreated, under-recognized, not enough research on this. So thank you for doing what you do. I really appreciate that.
Now, everybody, hang on just a second. I've got our listener shout out and a few more resources for you after this. I just love what Dr. Amigues shared about thinking of our bodies as cute little kids who sometimes need help. I don't know about you, but I absolutely have a stubborn little 2-year-old living inside me. She is the one who never wants to go to bed on time. I often imagine her stamping her foot and saying, I don't want to. Now, when Dr. Amigues talked about asking yourself what your body needs, I immediately had a picture of wrapping that cranky 2-year-old in a fuzzy blanket, giving her a cookie, and letting her take a nap. Maybe you need a nap and a cookie too. I don't know. But this question of what do I need right now? That is something that I have used since the very beginning of my journey. And it's an easy question to ask. The hard part is not dismissing the answer you get, right? So if you ask yourself, what do I need? And the answer is a nap and a cookie, we immediately want to dismiss that, right? But there's truth in that. Sometimes maybe we don't literally need a nap and a cookie, but what we really do need is maybe we need to eat something and maybe we need to take a break, right? Maybe that's what, quote, a nap and a cookie really means, is that we need some rest and maybe we do need something to eat. We need a break, right? So try that. Ask yourself, what do I need right now? And then really listen to that answer. And whatever that answer is, think about how you can maybe do that. Maybe the answer is take a vacation and, going to Hawaii isn't on the list right now. But you can take mini vacations, right? Like, again, think about what does that mean? It means taking a break. It means relaxing. It means resting. So think about how you can give yourself more of what you need. Now, if you would like to learn more about the topics that we talked about today, definitely, of course, check out Dr. Amigues' podcast, Unabridged MD, but we also have several other episodes on this podcast that you might find helpful. The first one I would recommend is episode 97. This covers a lot more information on Sjogren's, which is one of the other conditions that Dr. Amigues mentioned today. In episode 91, I go over several conditions that are related to fibromyalgia, and I go over those in a little bit more detail, so that might give you some other ideas of what it might be if it isn't fibromyalgia. Speaking of which, episode 87 literally asked the question, what if it isn't fibromyalgia? Talks about why getting a proper treatment and diagnosis is the key to feeling better. I can't tell you how many clients and students I've had who thought that all their symptoms were due to fibromyalgia. And as soon as we do things like really focus in on reducing their headaches or migraines, or uncovering a mold allergy was one of them. When we uncover all of these things, guess what? When they get treated, the fibro gets better too. So episode 87 talks a lot about that. What if it isn't fibromyalgia, and why getting a proper treatment and diagnosis is the key to feeling better. I also highly recommend episode 2, Your Body Isn't the Enemy. This is the cornerstone of the work that I do as a coach, and it's really the cornerstone of what Dr. Amigues talked about today. You and your body, you are on the same team. You're working on this together. Your body is not the enemy. Now, I know some of these concepts can be difficult to hear and difficult to embrace. Thinking of your fibromyalgia as a teacher who's here to help you. It's difficult. So if you'd like some help with this, definitely consider scheduling a consultation with me or with one of my students or coaches. We have got coaches who specialize in fibromyalgia patients who also have autoimmune disorders. We've got coaches who specialize in patients who have dealt with trauma. We've got coaches who specialize in helping moms or career women. There is a lot of speciality, I guess you could say, amongst our coaches. So there is a lot to choose from. And every single one of us has fibromyalgia ourselves. We know what it's like. We've gone through that struggle of who am I now? We've had the challenges of finding doctors who believe us and can actually help us. We've learned the science and the treatment options available for fibromyalgia and can teach you those along with life hacks, tips, and tricks from our own lives that can really help you feel your best. Most importantly, we care. We understand. We have been there and we can help. To schedule a consultation, go to findafibrocoach.com or visit today's show notes at fibromyalgiapodcast.com/123 for 123. And now I've got this week's listener shout out for you. This was a comment posted on our Facebook page by Mallory, and she says, "Your podcast helped me go from living life in bed with depression to going to college to find a better me. Thank you, Tami. Your podcast saves people." Thank you so much, Mallory. I have to say, it's been such a joy to watch your life transform as I've known you over the years. And just know I am sending you big hugs and congratulations and love right now. And that's what I'm talking about, folks. You know, if you want to go from living life in bed with depression, as Mallory said, to finding a better you, we would absolutely love to help. Again, those links are going to be in today's show notes, fibromyalgiapodcast.com/123. Now, next week, that's right, in 1 week, not our usual 2 weeks to an episode, I have a special bonus episode for you. I'm going to be interviewing one of my student coaches about her experience over the last year. So often we overestimate what we can do in a short amount of time, like a weekend, right? You have all these plans of all these things you're going to do, and maybe you get one done. But the flip side of that is we drastically underestimate what we can accomplish in a year. And a year with fibromyalgia can be the difference between being in bed with depression and living the life that you want to live. Of course, there's lots of other things that go with that, what other conditions you have, the resources you have available, all of that. But a year can make a massive difference. And so Kim is going to be sharing her before and after fibromyalgia story. We're going to start with her low point a year ago as her life kept shrinking. And we will end with where she is today, training to be a certified fibromyalgia coach, traveling and expanding her life. She recently shared this with me and I said, you've got to come on the podcast, because she did 2 trips 1 year apart, and the difference between those 2 trips and how she was able to just live the life that she wants to live is so encouraging. I just want to share it with you. So we will see you back here in 1 week to share Kim's story. And then in 2 weeks, of course, we'll have our next regular episode. See you back here next time.